Okay, Black Press USA, Totally Randy here with the lovely Caleen. I love how your mom got up there and said, "That's my baby."
Yes, she'll tell you that all
I
the
love
time.
that. Now you're bringing in some fresh new ideas with the Sisters Network, the largest organization for Black women when it comes to breast cancer, you guys.
Absolutely.
So we know that you've been doing this for 31 years, you and
31
your mom.
years, a pioneer, and it's a privilege to build on her legacy.
Right. Now, what are some new we talked a little bit about the
Hmm.
podcast you guys coming out.
Yes.
Your mom mentioned that you guys are taking it up to the government that's shut down currently
Yes.
when it comes to advocating for breast cancer. What
Absolutely.
are some of the things you're looking for when it comes to change in policy?
Right. So, because we have a footprint in over 30 states through our survivorship or affiliate chapters, we feel it's important at the state level to start with making an impact and an inroads because we have that strength.
Right.
And so we will be launching in 2026 Sisters Network Center for Public Policy, where we will be empowering our chapters not only to do the advocacy awareness work, but on the policy side, where state legislation means change, and change means hopefully better access and opportunity for better health care. And so we feel like it's important as an organization to focus on the state level where we're strong and look at policies and issues that align across several of our different states where we have a representation, and then push for certain legislation, and that could be biomarker testing, that could be supplemental access to screening, meaning once you've had a mammogram, sometimes you need an ultrasound or you need a biopsy.
That actually happened to me.
Right.
I
And
needed an
then the
ultrasound.
person doesn't get the coverage.
Right.
So we can't stop at just the mammogram. We need that woman to have access. And so that's where that supplemental coverage comes in to make sure that they have the next step should they need it.
Absolutely. And I love that. Now, I did see you at CBC. I saw that you
Yes.
were there, obviously doing that work. You were
Hmm.
there for Media Row as well. A lot of
Absolutely. That was
speaking to
great.
media, love that. Talk to us a little bit. Talk to Gen Z. Shout out to Leela Sims. She is radio personality on 95.3 Jams here in Houston, Texas.
Hey, hey,
She was
hey.
here covering it for that specific demographic as
Oh,
well. Gen
wonderful.
Z, a lot of young women think that, oh, I have time because I'm not 40. I don't need to have a mammogram
Right.
now. Talk to them and why they should support and be here as well.
Well, what I will say to my young sisters is that you don't have time. You need to know your body, number one. You need to know your family history. You need to advocate for yourself if something doesn't feel right. You need to know that it's okay to go to another doctor. Don't have that white coat syndrome, because at the end of the day, it's your body to protect. It's your priority to push your best health care and access to it. And so that's the message that we want our young women to know, is that they need to know their body, and when something doesn't feel right, get it checked. If the person that you're seeing at the moment says, I don't think so, or let's wait. We have a young woman I just spoke to last week for mammograms, I mean, ultrasounds, excuse me, because it's suspicious. And they said, let's just watch it.
Mm.
Um, I said, no, ma'am. She's 29 years old. I called Dr. Newman, who is our chief medical advisor out of New York. This young lady's in New York. Said, I need you to give her a second opinion. And she's already getting going to be seen by Dr. Newman, who will probably do a biopsy, because at this point, what are we watching for?
Right.
She's had four ultrasounds
Right.
on the same lump under her arm. That's criminal.
Right. And
Yeah.
what we know we're still facing though, it's so interesting. One of the biggest questions I had at CBC was, if we knew about Project 2025, why didn't we have a strategy and how we can combat that?
Mm-hmm.
And one of the answers that I received, and I pushed it out even yesterday because it was so powerful, was Angela Rye was saying, "Hey, we're fighting on all fronts. We're fighting for free healthcare. I mean, free healthcare. We're fighting for healthcare fair. We're
Mm-hmm.
fighting civil rights. We're fighting for better education. We're fighting for better
We're
air quality.
fighting.
We're fighting." So breast cancer is another fight.
Fight. Absolutely. It's
But
another fight,
yeah,
but it's taking too many of our sisters' lives. We consider it a Black breast cancer crisis when we have more Black women dying disproportionately compared to other ethnic groups.
hmm,
Black women under 35 are 2 times more likely to be diagnosed and 3 times more likely to die of breast cancer. That's unacceptable. Now, granted, the guidelines are age 40. We believe they need to be lower. But until then, we need to make sure our sisters are making their health a top priority. You make your hair a priority. You make your clothing a priority. You make those lashes a priority. Everything else, your Pilates now is a big thing. Your soft life. Okay, we get it. But it's time to make sure that you are around to do those things. Because I'm telling you now, we get over 3,000 calls a year, and we are starting to see more and more young women who are calling us about finding lumps and either getting, pushed away or being diagnosed immediately. And so we're even having a young survivor panel where we have two young women who are both under 35 who've been diagnosed in the last year.
And that's a great way to segue to that. First of all, let's go ahead and make sure, like the kids say, she clocked that. Okay, make your health your priority. All right.
Mm-hmm.
But let's talk. Thank you for saying that. Thank you for mentioning the panel, because
Mm-hmm.
we have the summit. This was the Pretty in Pink luncheon that we were
Yes,
we were at today. Very beautiful. Loved it.
it was
And
great.
Evie was
She
amazing.
killed it.
She did.
She was beautiful inside out and inspired everybody. And
Absolutely.
her spirit was just, it was wonderful.
Right. But we're here this weekend is the breast cancer summit.
Correct. And so we have workshops. We kicked it off with a fireside chat. I did a fireside chat with Dr. Caleen Chung out of MD Anderson. She's leading MD Anderson's efforts with AI and how they're incorporating AI with cancer care. It was very groundbreaking. I'm very proud to have had her here. And we're the first Black-led organization to have somebody come to our summit and talk to Black women about AI and how that's being incorporated into cancer care. We have Dr. Lisa Newman, who just presented on TNBC, which is triple negative breast cancer, very aggressive subtype of cancer, of breast cancer, and one that Black women get it. 1 out of 5 Black women will get triple negative as compared to 1 out of 10 of white women. So that's another challenge for us. And so we're looking to bring groundbreaking conversations, uh, medical experts from around the country, and having different panels on mental health. We're going to conclude on a mental health because your mental health plays a role in your survivorship, in your care, in your daily life. And so we want to talk about those things that not just about the treatment options, but things that affect everybody's
Right.
mental health, and especially given the time that we're living in now.
Right.
We're under assault mentally, physically, emotionally, and so we need as a Black community, we're getting better,
Right.
but we're not there in terms of talking about things, seeking mental health counseling when needed. We've made some strides, but we got some work to do still.
We have some work to do. And where can we support the work that you guys are doing?
Well, if anybody needs us with Sisters Network, you can come to sistersnetworkinc.org. We look for you to call us if you, need speakers, or you need to connect with one of our chapters. We have a breast cancer assistance program that we open 3 to 4 times a year, depending on funding. It's twofold. We provide financial assistance to survivors nationwide. It's been around since 2006, and we pay for mammogram. We pay for rent, mortgage, and utilities for a survivor who is in active treatment, active meaning radiation or chemotherapy. The other side of that is early detection, where we pay for 3D mammograms for women who can't afford it. And this is for any woman nationwide. We don't want the cost to be a barrier. So we partner with facilities around the country to ensure that access is not an issue for any woman to get a screening.
Right. I love that. So, ladies, you have no excuses,
None.
okay? There are no excuses. Sistersnetworkinc.org is where you want to go. They have a very beautiful new website. I even
Yes.
reported on it on TotallyRandie.com, but you can also find that on BlackPressUSA.com. You guys, the lovely Caleen, thank you for sitting
Thank you
with
so
me
much.
and
And thank you
talking
for
about
saying
it.
our website's pretty.
It's gorgeous. I love it. I was just like, ah, it's new and
It's
shiny.
new and
And
shiny,
you
and we're
want to
so proud of
interact.
it. We're
Yes.
very proud of it, and so it was a labor of love, and we launched it about 2 months ago,
Yes.
and it's more interactive. It's going to allow us to you know put things on there that our other platform was built so long ago that it just was not conducive to putting our podcasts or other digital opportunities. So we're excited. It's
Absolutely.
going to really amplify our work.
That's right. And the podcast drops October 8th, you guys. So make
Yes.
sure that you guys are going to Sister Network Inc., sistersnetworkinc.org, and you will see all of the resources there. And yes, I thank you so much for talking with
Thank
me.
you. Thank you.
You guys stay tuned for Who's Talking with Totally Randy next.